Hi everyone, I'm back again. Same day, same time. Here I am. Um, so I got ow. Sorry, my puppy just kicked me in the butt. I got tagged to do some questions, and now you'll see me squint because I have bad eyes and I need to go get glasses. I got tagged to do some questions. If you want to know what these questions are, I will put them in the description below. But I'm going to answer them very short, very sweet, because that's just how I roll. One, what is your due date? I am due April 9th, 2013. I am a C-section, so I will be going early. I'm going to try to talk my doctor into April 1st so I can have an April Fool's baby. Have you or when will you tell your employers about your pregnancy? I thankfully work for family, so it won't be a big deal to tell them. However, we do not tell anyone we are expecting until we let past 20 weeks. So that means we've told once out of 11 times because we've had so many losses. We don't see the necessity in upsetting our family over and over and over again. And some people like to use the whole, well, they need to be there for you thing, and that's bullshit. No one needs to be there for you other than your husband, and so it's really selfish to ask others to share in your pain just because you feel bad. I mean, honestly, you're sad, so you want everybody else to be sad with you. That's not fair. And there's nothing they can do to help you. There's no support you need when you lose a child. You just need to grieve and with your partner and move on. That's my personal opinion on my life. It doesn't mean it works for yours. Me personally, I couldn't imagine putting that burden on my family. Will we find out the sex? Of course we will. My husband and me are already excited. We do 4D scans at 15 weeks every time, so that we'll know. We've only had a few make it that far, so we've only known a few. But yes, we'll be doing a scan 5 weeks today, so it'll be scheduled in 10 weeks period. Do we want a boy or a girl first? Well, I have a son from a previous relationship. However, my husband wants a son, but I want a girl secretly. But we're not going to tell him that, right? Do we have names picked out? We have our boy name. It will be James something. James is the family name for my husband. He's James. His father's James. His grandfather's James. They all have different middle names, so it'll either be James Maston or James Legion. So we'll see. Will we use a home Doppler? Yes, I already have one. I had one from my previous pregnancies. However, whenever I lost my daughter, one of the biggest regrets in my head was I wonder if using that Doppler every day did something that affected her. So I will not be using it as often as I did. I was using it 2 or 3 times a day with her pregnancy, and though it probably didn't have anything to do with losing her, it's still a question in my head, so I will maybe use mine once every other day, every 3 days, something like that. Will I do belly shots? I will do belly shots in my pregnancy logs here on YouTube, and I'll also be taking weekly pictures. I will not be doing weekly belly shots on YouTube because I think it's silly, especially for somebody my size. I'm a big girl. So I think it's silly for somebody my size to do like, I'm 5 weeks, I'm 6 weeks, I'm 10 weeks, I'm 12 weeks, because you cannot fucking tell. If you are fat at 12 weeks, that means you are fat, because the baby is like this big at 12 weeks. That is not showing. Period. I know smaller girls' uterus, your uterus at 12 weeks like this. So if you're teeny, tiny, skinny, you might have a bump. But if you are out here, that is bloat and gas and fat. Will I get a P.O. box for YT share a registry? I don't even know what that means. I don't know what YT share a registry is. Sorry. I don't know what that is. But no, I won't be getting a P.O. box. I have a home. I have a house. Anything I get from a registry or anything like that will come to my house. Do you have nursery ideas? I do. I don't have one. Excuse me. Hang on. I spent probably $2,000 on a nursery with my son. I did a crib, beautiful crib, and his name on the background, and the little carousel, and the bumpers, and the bags, and the decorations, and the floor mats, and this and that, and he never used it once. He slept in his bouncy room next to my bed when he was newborn because he had really bad acid reflux, so he had to sleep sitting up. So he slept right next to me. And then when we weren't, we did sleep with him in the bed, but we didn't like co-sleep with him in the bed. It was really weird. We have a co-sleeper, so it has sides on it. The sides are like about 12 inches high, actually. They're like this high, and it's like a little basket all the way around, so you could put him in the bed, but the blankets can't get over you, and you can't roll on him, kind of thing. So he used that till he was 10 months old, and then he was walking by 9 months and able to, you know, whenever I did put him in his crib for a nap or whatever, he would be in the floor at 9 months when he was awake. So that was just dangerous. So we just kept him in our room until he was about 11, 10 months old, and then we bought him a toddler bed where, you know, he could just get in out of bed. You know, we just made him a room with like a little boy stuff. And that little boy stuff lasted. He's 5. We just now redid his room to Transformers like 6 months ago. So, not that big of a deal. I'm not going to waste money on a nursery. If I do, it's because I just go absolutely stupid pregnancy-wise. And I decide that I'm just over the hills moon. Which, you know, where we've had so many losses, I can't say my dumb ass might go out and spend money on nursery crap. So, we'll see how that goes. I say no, but home birth or hospital birth. If this was my first pregnancy and everything was going perfectly and I didn't have to have shots and I wasn't breech or any, and then, you know, I hadn't had a bicornuate uterus that had to have surgery and I didn't already have a previous C-section, I would do the home birth for sure. Less, you know, complications. That's if you do your research and you educate yourself, it's not risky at all, like the medical community would want you to believe. There's risks, just like there is anywhere else, but as long as you are informed and your midwife is informed and you're not going into this uninformed, then there shouldn't be an issue whatsoever. There's nothing you cannot do at home that you cannot do at a hospital, and vice versa. Except, of course, you know, resuscitate a baby with electricity, because you can do CPR at home. But I can't, because I've had a laparoscopic surgery, I've had kidney stone removal, I've had an appendix surgery, I've had a C-section. So I've had probably 5 surgeries on my uterus pelvic area, so it makes me very high risk for even trying to have a baby, let alone having one at home. However, I am going to talk to my OB when I have my next actual appointment, which will be, I don't know, a couple weeks, I guess, about my risks and pros and cons of C-section versus trial labor. So we'll see. She does work at a hospital that has an on-call anesthesiologist. She is one of the main doctors at this hospital. It's a women's center, so the only people in the whole hospital are women who have had babies. So that's totally awesome. When we lost our daughter last year, we gave birth to her in the women's center, and it's like a freaking hotel room. It's amazing, and the nurse and staff were absolutely perfect, so I'm excited to have my baby there. Planned C-section, epidural, or natural birth. Like I just said, more than likely it will be a planned C-section, but we will see. If it's not, then I'm going to have an epidural. I did it with my son. It only worked on the half of the side, but I did have one with my daughter last year, and it totally worked perfectly, and it made me like them again. Will it work outside the home after the baby's born? Yes, I will work outside the home after the baby's born. Not a lot. I'll probably work 20, 25 hours a week, but I will work, because I will go fucking apeshit crazy and stupid if I don't. Will I breastfeed? If so, for how long? This is going to spark a lot of controversy and probably a lot of comments in the thing below, but I don't know. And there's a few reasons. One, I am on Xanax for severe panic disorder. Last time I tried to come off of my Xanax when I was pregnant, it immediately sent my blood pressure through the roof. I had massive seizures, and yes, this was tapering off. This wasn't just quitting. I ended up in the ICU, and my baby ended up passing away. So, with that said, they told me to lower my dose as low as possible before getting pregnant again. So I got down to a half a milligram. Well, I was on 4 milligrams, so I'm down to a half a milligram a day. And they have told me to wait as long as possible to come off because they don't want anything to happen to the baby. So that means that my OB has suggested I even stay on the quarter to a half a day until like 2 weeks before I'm supposed to have the baby, and then quit. That way the stuff's out of the baby's system before they're born. But I'm really scared to quit and something happened to the baby, because Xanax half-life is very, very short. It's 12 to 24 hours. So I I don't know. We'll see how that goes. I feel like a shitty ass person even being on it while I'm pregnant, but I've seen the consequences of me coming off whenever I am pregnant, and a child's life is worth more to be brought into this world a little uncomfortable for the first 24 hours of its life than to not have life at all. Alright, so, cloth or disposable? Disposable. Sorry, I'm not one of those people who have time, want to, or whatever to cloth diaper my child. Will we co-sleep? Like I said before, we will co-sleep in a manner that is safe. We will use the not bumbaboos, but I can't remember the name of it, but it's like a little crib thing that sits inside of your bed, so you can't roll over on. So those are my questions that I had to answer for now. I'm glad you guys stopped by to see the answers to my questions, and if you have any questions about my questions, feel free to comment below. All negative comments regarding anything that I have said will be removed because this is a positive post. However, your opinions and stuff may be posted as long as they're done in a discretionary manner.